7 Tips to have a healthy heart. Your heart is the most important muscle in your body. However, people don't normally take care of it like they should until it doesn't work right. Heart diseases are one of the principal causes of death around the world. To avoid them, we recommend that you do everything you can to maintain a healthy heart. How? In this article, we'll tell you tips for a healthy heart. Healthy habits are essential for both living longer and better. Reducing the risk of suffering any cardiac disease is simple. However, this depends on how much you want to change your day-to-day life. The small things in your everyday life can make the difference between having a healthy heart or suffering a heart disease. There are aspects that we can't change: sex, age, genes, etc. However, outside of them, it's worth it to make the effort. Living a healthier life to take care of this muscle is very important. Pay attention to the following advice. 1. Start eating a balanced diet. We aren't saying that you have to give up flours, fried foods, and sugars forever here. We aren't even saying that you need to start eating a vegetarian diet. However, you need to change the foods that you regularly eat. You need to avoid abusing saturated fats and manufactured foods. These are directly proportional to the risks of suffering from heart problems. Being careful with the amount of salt, red meat, and cold cuts you eat is important. On the other hand, adding more fruits and vegetables to your diet is always good. They not only let you enjoy a healthy, they also help the rest of your organs to work perfectly. Legumes, nuts, and whole flours should also be in your dishes. 2. Exercise. Being sedentary is one of the main risk factors for coronary heart disease. On the other hand, playing sports and exercising give you many benefits. Among these benefits, you find weight loss, prevention of arteriosclerosis, and a reduction in cholesterol or blood sugar. For adults, it's recommended to get at least 150 minutes of moderate physical activity per week. You can also do 75 minutes of intense exercise. The ideal activities are aerobic, walking briskly, riding your bike, swimming, or running. 3. Eat healthy snacks. This could be at home or in the office. Try to change this habit that makes you choose unhealthy foods between meals. At mid-morning, don't go for a coffee with cream with a pastry. Instead, eat a yogurt with cereals or a fruit. When you get back from work, don't just sit on the couch with a bag of potato chips. Choose sunflower seeds or almonds instead. Healthy snacks don't need to be boring or flavorless. What about carrot sticks with hummus or eggplant cream? Or whole wheat sandwich with avocado and lean chicken? There are thousands of options at your fingertips. 4. Reduce your stress. Of course, there's a close relationship between nerves, anxiety and heart problems. Some people are more prone to suffer from stress. Many people let themselves be carried away by negative thoughts. If you find yourself in this group, you need to find a relaxation technique. You can try yoga, meditation, or even therapy. Other ideas are traveling through the countryside, soaking in a bathtub at home, reading while stretched out on the couch, listening to relaxing music before going to sleep. 5. Don't smoke or drink alcohol. Tobacco has many dangerous substances. They cause lung or stomach cancer. In addition, it has a toxic effect on your heart, veins, and arteries. Cigarette smoke increases the possibilities of suffering from thrombosis and reduces your blood flow. Unfortunately, you have to be careful if you don't smoke. You could suffer the same effects if someone close to you has this habit. When talking about drinking alcohol, there's a comment that needs to be made. Drinking a glass of red wine per day isn't bad, it's just the opposite. Other drinks, especially those taken in excess, can cause severe heart problems. The appearance of heart diseases is often related to drinking too much alcohol. 6. Maintain your ideal weight. Obesity and being overweight are tied to several heart problems. Your body mass index is a test that can help you. It tells you exactly how many pounds you should weigh to be at your ideal weight. However, it's not the only method available. For those of us with a bit of extra weight, simply losing a bit of weight helps your blood pressure to regulate and your arteries to become healthier. Knowing what your ideal weight or size is isn't to make you obsessed. Instead, it's to help you decide to lose weight using every method available to you. Losing little by little is healthy for those of us with extra weight. It's healthier than a miracle diet that promises to help you lose 20 pounds in less than a week. Finally, you shouldn't stop eating to achieve your objective. You'll only end up making yourself sick. 7. Get enough sleep. How much is enough? That depends on each person. However, it's estimated that you should get between 7 to 9 hours of sleep as an adult. Having good sleep habits is beneficial for your heart. This is because it reduces your risk of tachycardia or heart attacks. If you only sleep for a few hours, your body won't produce the amount of serotonin it needs. This hormone is in charge of making you feel good and comfortable. If you don't find this hormone in normal doses, it can make you want to eat and drink more. Heart attacks. Bananas and avocados can prevent heart attacks. If you're fairly familiar with the vitamins and minerals in the most common fruits and vegetables, you may be aware that in bananas and avocados, potassium and magnesium are notable ingredients in both of them. Like all foods, these two powerhouse fruits, because both are fruits rather than avocados being a vegetable, have many other things to offer, but scientists have recently announced that both foods have the potential to prevent heart attacks. The research was conducted at the University of Alabama and was published in the journal JCI Insight. In fact, scientists have revealed that if you eat a banana and an avocado every day, you could eat yourself right into protection from heart disease, or more specifically, the atherosclerosis or hardening of the arteries that often leads to a series of disorders, NDTB reported. Additionally, it may also lower your risk of arterial blockages, which often necessitates surgery. It's the potassium in these foods that can alleviate a large part of the burden, the study indicates. The animal study found it reduces vascular calcification, one of the complications of kidney disease and cardiovascular disease. Mice were fed alternate diets containing low, normal or high levels of potassium, and those with the highest levels had substantially more pliable arteries, while those given lower amounts had much harder arteries. It works the same way in humans. When you include foods in your diet that contain good amounts of these minerals, these symptoms are alleviated, particularly the stiffness in arteries seen as a precursor to cardiovascular problems. Problems occur because the stiffness in arteries can cause your heart to work harder to pump blood through your body. Artery calcification is just one of the problems that having a consistent amount of adequate potassium in your diet can help prevent, and all of them are serious and related conditions. Heart disease, stroke, metabolic syndrome, chronic kidney disease, CKD, hypertension, calcification and what it means for your arteries. Calcification is a buildup of calcium in your tissues, organs or blood vessels. As it's in the process of forming, it can call a halt to the necessary process that keeps your body working as it should. According to difference between arterial sclerosis is a defect occurring in the artery, blood vessels carrying oxygenated blood, walls. It refers to hardening of the normally flexible walls due to loss of elasticity of the arterial musculature. When young, the arteries are flexible due to the presence of a protein called elastin. As age advances, there is loss of this elastin causing thickening of the arterial walls. Atherosclerosis is another condition that refers to the deposition of fat plaques and cholesterol globules within the arteries causing narrowing of the lumen of the arteries. The scientists noted that vascular smooth muscle cells, or VSMCs, contribute to vascular calcification and atherosclerosis and that arterial stiffness has become an independent predictor of cardiovascular morbidity and mortality, representing an important health problem for the nation as a whole. According to their research, vascular calcification may be more culpable in aortic stiffening than scientists originally thought. In fact, a 2009 study is even titled Vascular Calcification, the Killer of Patients with Chronic Kidney Disease. The study noted, previously considered a passive, and regulated, and degenerative process occurring in the arterial media, vascular calcification has now been demonstrated to be a highly regulated process of osteochondrogenic differentiation of vascular cells. Further, VSMCs were found to produce extracellular matrix proteins that actually cause the arterial calcification process to happen faster. People with less potassium have higher risks. It's no secret to the scientists that potassium plays a crucial role in staving off arterial calcification and related diseases. In fact, previous studies have made it clear that the association between low blood potassium levels and death from either chronic kidney disease or metabolic syndrome, while clear, hasn't been investigated thoroughly. The study made something else clear, that appropriate dietary potassium intake improves those pathological conditions. The researchers also noted that, Whereas the direct influence of dietary potassium on the development of vascular calcification in atherosclerosis hadn't yet been established and characterized, for the first time they'd been able to produce evidence that potassium was the key. While consuming too much of it can cause problems, too, such as a stomachache, nausea and/or diarrhea, according to International Business, Times, it's clear that what you eat directly influences your risk of these serious diseases. That's why, for these diseases, especially, bananas and avocados are two of the foods containing the potassium that can lower your risk. In response to the study's findings, Dr. Mike Napton from the British Heart Foundation observed that with more research, we might be able to see if the disease forms in humans in a similar way and develop treatments. Magnesium and potassium, interrelationships in regard to health. When it comes to maintaining a healthy heart, as well as properly functioning kidneys, nerves and muscles and blood pressure regulation, having an adequate intake of magnesium on a regular basis is key. Because it's the fourth most abundant mineral in your body, on which more than 600 functions hinge, getting the right amount to avoid a deficiency is critical. But there's more to it than that. The National Academy of Sciences assessed the role of several nutrients, including magnesium, and observed. Magnesium has been called nature's physiological calcium channel blocker. During magnesium depletion, intracellular calcium rises. Since calcium plays an important role in skeletal and smooth muscle contraction, a state of magnesium depletion may result in muscle cramps, hypertension, and coronary and cerebral vasospasms. Magnesium depletion is found in a number of diseases of cardiovascular and neuromuscular function, in malabsorption syndromes, in diabetes mellitus, in renal wasting syndromes, and in alcoholism. Classic symptoms of low magnesium include muscle spasms, unexplained fatigue, irregular heart rhythms, eye twitches and even anxiety, but those that can be difficult to spot until after it's established that low magnesium levels are what's causing the problems. Studies show that problems such as asthma and osteoporosis may also be involved, along with symptoms that indicate possible related deficiencies, including potassium. In response, experts recommend that individuals with these symptoms assume that low levels are likely the problem and begin remedying it immediately by concentrating on higher magnesium intake, either through supplementation or food, and maybe both. One of many reasons is that the body begins stripping magnesium and calcium from your bones during what is called functioning low magnesium. Ancient Minerals explains. This effect can cause a doubly difficult scenario, seemingly adequate magnesium levels that mask a true deficiency coupled by ongoing damage to bone structures. Thus experts advise the suspicion of magnesium deficiency whenever risk factors for related conditions are present, rather than relying upon tests or overt symptoms alone. One study shows that intracellular concentrations of magnesium and potassium are closely correlated, and the ratios in your cells are what's important, not the concentrations, and hypokalemia, aka low potassium, can be induced by the same mechanisms and are often clinically related to one another, especially as they relate to cardiac arrhythmias and, arguably, other heart-related disorders and diseases. The upside is that when you begin ingesting adequate potassium and magnesium, bananas and avocados would be a great start. The above symptoms can be reversed, i.e., regulation of blood sugar, better sleep, less stress, improved mitochondrial function and increased energy.